Welcome to Med-Surg Mini number 9, where we will talk about T-cell deficiencies. T-cell deficiencies include deficiency of our T lymphocytes, which have CD4 helpers and CD8 cytotoxic T cells. These facilitate cell-mediated responses against fungus, protozoans, viruses, and intracellular bacterial infections. They also help to prevent malignant cell proliferation. Deficiency in this is more severe than our typical B-cell deficiencies, and it can lead to more severe infections and types of cancers. Examples of T-cell deficiencies are Degeorgeous Syndrome, chronic mucocutaneous candidiasis, and hyper-IgM syndrome. Degeorgeous syndrome is an autosomal dominant disorder on the 22nd chromosome. It is congenital, meaning that it's present at birth. The pathophysiology behind Degeorgeous syndrome is that our pharyngeal pouch typically develops into our thymus, parathyroid gland, pulmonary artery, and aorta. But sometime between 6 and 10 weeks gestation, the development of those pharyngeal pouches into those different body parts is deficient. So we have abnormal development of those different body parts, and it can affect one, it can affect many. So our symptoms and our treatment is going to be based on which cell the pharyngeal pouch is unable to treat. So this leads to impaired thymus gland development, which then leads to impaired T cell production and differentiation. It also leads to impaired B cell activity since T cells help to mature B cells. The symptoms of Degeorgeous syndrome, like I said, is based on which pharyngeal pouch was affected. We typically see increased yeast, fungal, protozoan, and viral infections, weakness and fatigue, failure to thrive, shortness of breath, blue-tinged skin, muscle spasms, especially in the mouth, arms, and throat. So you want to be especially careful about any muscle spasms in the throat that may obstruct the respiration. We typically will see poor muscle tone, delayed development, and lack of meeting infant milestones, learning and behavioral problems in childhood, and a cleft palate. An acronym that is used to describe kind of more of the severe symptoms of Degeorgeous is CATCH. So cardiac abnormalities, especially the tetralogy of Fallot, abnormal faces, thymic aplasia, cleft palate, and hypocalcemia and hypothyroidism. The diagnostics are done through genetic testing, as well as measuring calcium levels, which will be low, and white blood cells, which will be high. Our treatment of Degeorgeous syndrome is infection control, as well as symptom development based on the type of Degeorgeous syndrome they have. We can provide calcium supplements, especially to prevent that seizure activity that's associated with low calcium levels. We can do IVIG therapy every 3 to 4 weeks, prophylactic antibiotics, bone marrow transplant, thymus tissue transplant, cardiac surgery, and cleft palate repair. Our complications of Degeorgeous syndrome is it can lead to impaired brain development, learning, social, and behavioral development impairments, speech delays, ADHD, autism, increased risk of depression, anxiety, and schizophrenia later in life, risk for respiratory dysfunction and poor airway function, and risk for malnutrition. Other T-cell deficiencies include chronic mucocutaneous candidiasis, which is an autosomal recessive disorder, and it's an autoimmune disorder that attacks the thymus and endocrine glands. So this increases the patient's risk of tetany as well as candida infections. There is a high morbidity rate with chronic mucocutaneous candidiasis, and this is due to hypofunction of the adrenal cortex. Then we have hyper-IgM syndrome, which is an X-linked disorder, and it causes immunodeficiency of IgG and IgA. While our IgG and IgA are deficient, we are going to see much higher levels of IgM and IgD. This disorder has variable impact on IgG subtypes. Basically, what it does is it produces a deficient cell-mediated immune response. So it increases in occurrence of sinusitis, otitis media, tonsillitis, pneumonia, and other opportunistic infections. It can also lead to blood disorders such as hemolytic anemia, thrombocytopenia, and neutropenia. And that wraps up our discussion of T-cell deficiencies.